Welcome back, pet parents. So, one of the things that I've noticed recently for me is that I have to hear something so many times before it really sinks in. And I think a lot of people are that way because one of the keys to learning is repetition. And what I also find is that sometimes we're in a good space to be able to hear and receive something, and sometimes we're not. And that's okay. Life happens. But what I know, and going back through some of the guests that I've had on the podcast and going through some of the conversations that we've had, sometimes there are themes. And sometimes what I notice more than anything is the vast amount of wisdom that some of these guests in particular have and really try so hard to impart onto the world. And some of our integrative veterinarians and holistically minded veterinarians are the wisdom that they have provided on the internet in general is just incredible. But on this podcast specifically has really touched my heart because it is completely out of the goodness of their heart that they put this information out into the world. They want your pets to live a better quality of life. And so what I decided we're going to do this summer is start going back to, we're still going to do new guest episodes, but we're also going to start going back to some previous episodes and highlighting parts that I wanted to hear again for me. And because I wanted to hear them again, I know you want to hear them again. It could be something you already know. It could be something that you're like, I have heard that, but oh my gosh, I completely forgot about it. And it could be something that you were like, wait, I don't even remember hearing that. And that's totally okay because first and foremost, not everybody has been listening to the podcast since the beginning. And for those of you who are new here, I want to say give you a warm welcome. Thank you so much for being here. And if this is the first time you're listening to me, my name is Jessica. I'm a certified canine nutritionist and certified holistic pet health coach, as well as a positive reinforcement dog trainer. And on this podcast, the Pet Parenting Reset, we talk about everything proactive health for your dogs and cats. And a lot of times that includes you as well. At least that's what I found for me and my personal journey. So we're going back and pulling from some of the incredible wisdom that Dr. Katie Woodley has shared on this podcast. And if you're not familiar with Dr. Katie Woodley, she is a holistic veterinarian and she is the visionary behind the Natural Pet Doctor. She's fervently devoted to weaving Eastern traditions into Western medical practices. Her drive stems from personal experience, witnessing firsthand the gaps in the medical system during her husband's battle with an autoimmune disorder. I bet some of your pets are struggling with that too. Now, her mission is crystal clear, ensuring pet parents recognize there is a holistic pathway to detect, treat, and prevent diseases. The Natural Pet Doctor is a beacon of hope rooted in species-appropriate nutrition, herbal solutions, and other holistic avenues. Dr. Katie demystifies holistic pet care through her comprehensive online program, Healthy Holistic Pet for Life Blueprint, bridging the gap for those without easy access to holistic veterinary expertise. She's committed to restoring hope and confidence, showing the natural ways to ensure that our pets flourish. And I don't know about you, but for me, that's exactly what we need. That is exactly what so many people are searching for right now, today. So thank you to Dr. Katie Woodley for providing all of this incredible wisdom for us. Let's get right into today's episode.
And, I always say we do the best we can with the information we have at the time. And I've been there. Like I've had 3 pets that have gone through cancer. So I've had my own pets through this journey too. And, my 2 cats were at the very beginning. And I didn't have a lot of these tools. And then our dog developed a brain tumor. He started having seizures, and thank goodness I had tools to help him, because we were told there's nothing else you can do, and to just take him home and bring him back in a week. And we were able to gain an additional year of life. So, being on both sides, but also being so grateful that I had the skills and knowledge to be able to not say like there was nothing else and, put him down. But going back to colleagues also, this is why I've kind of come to my own business too, because working in a conventional setting and wanting to integrate in a lot of these holistic modalities, I think what happens is the conventional side looks at holistic, right, as not science-based. And the problem is when we look at a holistic approach and we look at a conventional approach, so you'll hear like Eastern versus Western medicine. And the way I approach it is it's not one or the other. We can integrate them together, and that gives us the best results. But the big difference is, and also why we get a lot better results when we look at holistic or an Eastern medicine approach, is that we're actually looking at the whole body. So I always say holistic with a W, because everything's interconnected. And this is the hard part with a lot of the way that the studies are set up, is that we have a drug to treat a symptom. But when we look at a pet or we look at ourselves from a holistic perspective, you have different environments, you have different foods coming in, you have different stress levels, you have a different microbiome imbalance. And so being able to say like this supplement or this herb works the same way for every person, we're doing a disservice to ourselves, and we're not able to, like, that's the hard part about studying it from a traditional like scientific study. And Chinese herbal medicine doesn't work that way. We can have the same disease, we can have the same symptoms, but that pet has a different underlying imbalance. And I might use a different herbal supplement for this pet versus this pet who still has like Cushing's or diabetes, because they have different patterns. And so that's the hard part with it. But there is more and more science coming out, which is good. But I think the biggest thing too is that for people that are looking at us and saying this is all woo-woo medicine, it doesn't work, we have to go and look at conventional medicine, and it has its time and place, and it's important for acute symptom care or emergencies. That's where it should be utilized. If your pet gets hit by a car, you want to go into the vet clinic and have care right away. You need to support them, stabilize them with conventional drugs. However, we're only treating symptoms. We're not using a drug to fix the root imbalance of why that happened in the first place. So allergies are a great example, and they're one of the most frustrating conditions to treat when you only use conventional medication to treat it. And a lot of times it comes down to a gut health issue. There might be a yeast overgrowth. We could have heavy metals. We do a lot of heavy metal testing through hair tests. And that was the missing link that we didn't know about. And when we heal that and we help the detox pathways, because we looked at the whole system, all of a sudden the allergies go away and that pet's more comfortable. We didn't have to keep them on drugs like Apoquel or Cytopoint injections. Sometimes we need to use it short term to give that pet comfort. But this is where looking at the body as a whole is so different. And it's just a mindset shift, and we're not taught that way. So it's a huge change for a lot of people that have never been exposed to it before, or were forced to go down this path because of developing, autoimmune disease, like our journey of stumbling upon something. We needed a solution, and conventional medicine was not working.
Yeah. And conventional medicine has really, for lack of a better word, brainwashed us all into believing that there's a pill for everything, and that your doctor or your veterinarian, and I don't mean this in a derogatory fashion at all, but they're the only ones that can help. And being a veterinarian, of course, so much that the average person doesn't know about, our pets. But there's a whole world out there, like you were just talking about. Doing a detox is very trendy right now, but how much is that going to help you if all of your pathways aren't open?
Yeah. And here's the other thing too, like acupuncture also, I see a lot of the aftercare. What happens is, and I see this with my patients and my clients, is that they go through something traumatic like that. And there's so much we can do to support the healing after also. So, but so many of these pets aren't being offered rehab or acupuncture or even using supplements that are going to help reduce like the possibility of scar tissue, or if there's going to be chronic inflammation that builds up, because there's so much more research now coming out too, where these medications that sometimes we need to use, right?
Yeah.
Like the dog was shot, like we needed to use pain medication, that's important. But those can also affect the microbiome and can affect other pathways in the body. And we're not taught to think about that. And so a lot of these vets just don't know. And then what can happen is if this pet had an imbalance prior to that situation, now we just potentially made it worse. So we might not have seen outward symptoms. And I find this is kind of like a trap we get involved in for ourselves and our pets, that just because we don't see something outward doesn't mean something's not occurring inward. And I always say we're on this spectrum of disease, right? Where we have down here, like death, of course, right? At some point we're all going to pass. And down here, like perfectly optimized health. There's no, like, we deal with acute inflammation, we resolve it, everything's working together the way it's supposed to. And as we go through life, we're constantly traveling along this spectrum of health. And what will dictate how well we do is the foods we eat, the supplements we take, the environment, reducing toxins, supporting a healthy emotional like status, stress level wise. So there's so many things that we can do, which is so much more empowering than like the reactive medicine and watching and waiting for something to occur and then taking action, because it's so much harder to reverse and heal disease than it is to prevent it in the first place. So, this type of approach is, every day, all day long, I would rather do this type of approach than go back to a reactive approach and just wait and see what happens. Because, even I think the hardest part for pet parents when they get started on this journey is the overwhelm, right? There's so much information. What do I start with? Am I going to create harm for my pet? And a lot of times just doing one little simple thing, like topping the pet food for your dog with like cruciferous vegetables, makes a huge difference to their overall health. And then it gives you more confidence to take the next step and then the next step. And, so I think that's a big, like, that's where a lot of people get stuck with like creating this holistic life and being overwhelmed and not sure where to go.
You keep saying the word empowering. That's something that I talk about a lot too, because it is very empowering when you have educated yourself and you have additional knowledge outside of the box that we traditionally live in, and how much better you feel, how much more confident you are walking into your vet's office, even when you have done your research and you're educated and you know what you want out of your vet visit and what you're willing to do and what you're not willing to do. And the courage and the bravery to say, thank you for that information. I appreciate it. I'm going to take it with me, think about it, and make a decision.
Yeah. The first patient that comes to mind where we saw such a dramatic improvement, his name's Roper, and he's wonderful. But however, he was he's an Australian cattle dog, and he wasn't hypothyroid yet because it hadn't been diagnosed, but he was having a lot of back pain. And so they actually brought me in for their other dog that had a bladder tumor that was misdiagnosed, and it kept being treated as a urinary tract infection. And so we came in and got the right testing and actually diagnosed the bladder cancer. Unfortunately, it was pretty advanced. However, their other dog was going through all this back pain. He was kind of grumpy. He was reactive. His coat didn't look good. And he was going every single week to the chiropractor for an adjustment for like the past year, every week. And it wasn't holding the adjustment. And so we went through, so what we do is we look at all the records, we look at like previous blood work, we do a physical examination just like we would if, if I was seeing him in a conventional setting. I do house consultations in this area, so I get to
Mm-hmm.
see the environment too, which is really helpful. So it gives me an idea of, other factors like environment talks. They live in the countryside, there's lots of farming, lots of spray, so pesticides, things like that. So it gives me a bigger picture. But we ended up testing for thyroid disease. He came back really, really low. He was hypothyroid, and he's 6 years old. And I don't know if he's had that his entire life. And so we were able to help that. We did some microbiome testing, and he had severe dysbiosis present. We also did a hair tissue mineral analysis test, and he was really high in aluminum. He was also higher in mercury too. And then he had some arsenic and cadmium and lead. Every single pet we test come back positive for heavy metals, but it's the levels. He was at, I believe, 40 for aluminum. We want 0. So he's pretty high. So we needed to support his detox pathways and also adjust his diet and his digestion and all of that. Now he's getting acupuncture sessions every 2 to 3 weeks. His back's not painful. He's a different dog. His digestion has improved. His coat is beautiful. And when he goes for like the chiropractor, his treatments stay. So he doesn't have to go as frequently. And so he's a different dog now. And that's because we didn't forget about the conventional side. We just did a more comprehensive thyroid panel and actually tested for it. And then we ruled out some of the other factors that were impairing the healing of his body from occurring. He was already on a raw food diet, but because of the heavy metals, because he had this dysbiosis, the bad bacteria is outnumbering the good in his gut, he wasn't absorbing or digesting the food. And so by tweaking and adjusting all of those areas, now his body's working much better. It's a longer process. That's the downside with holistic. However, he's doing really, really well now. We've been working together we're probably going on almost a year now. So he's doing great. So that was a really good example of like, okay, something's off, just he was on carprofen, he was on Rimadyl constantly for his pain, and it wasn't helping him much. And so this is where, for pet parents listening, like if they have a dog or a cat and there's a chronic health issue and you're giving a drug and you're not seeing the improvements that you want, 100% try to find a holistic vet or an integrative vet that you can partner with, or just continue to learn and then ask those tests to be run or find people that can run those tests and give you a better idea of what's going on. One of the cats, who's over here, we adopted him right after our Finn, our German Shepherd, passed. And he's a great example of what happens. Like, he was a rescue. He was about 10 weeks old when we adopted him. He came to us, he had diarrhea. He had been on multiple rounds of antibiotics for upper respiratory infections. He was being fed a prescription diet as a kitten. He was neutered, as soon as they could. And this is a common scenario for a lot of, especially like cats. We have upper respiratory illness, we have diarrhea potentially, we have a lot of stress problems, got health issues. And, when we got him, they said he's going to be on a prescription diet for the rest of his life. And I was like, no, he's not. Day one, I took him off of it. I was like, no. And we used whole food supplements. We used digestive support to help him. We made sure he was in a calm environment, that we provided environmental enrichment for him. And, he was one that we had a separate room for him, and he lived under the bed for a week. Like, I couldn't touch him. I would just lay there and try to just read and get him used to, feed him in there and get him used to us. And then he decided one day, 7 days after we got him, it was safe. And his gut health is good now. We've tested it. We've looked for heavy metals for him, and he's doing so much better now. He's a completely normal cat that's on a raw food diet. And so this is where, if I had just listened and said, oh, yeah, prescription diet, for one, that's super expensive. And two, it's a dry prescription diet for a cat. It's not the most species appropriate diet for him long term, and could potentially lead to health issues down the road. So, he's just a good personal example of being able to look at him as a whole and see where the imbalances are, and what can we improve, and we adjust based on his responses to what we're doing.
Wow, that was absolutely incredible. Thank you so much to Dr. Katie Woodley for providing all of that wonderful information for the Pet Parenting Reset and all of you pet parents out there who are listening today. I'm just so thankful for you for everything that you are doing for yourselves and for your pets. If you haven't already given us a follow on whichever podcast platform you are listening on, please do that today and review us. That's actually one of the best ways to get us seen by new pet parents who may not already be listening to the show. If you happen to be watching on YouTube, that means subscribing, liking, and commenting. Next week, we will be back with an all new episode and an all new guest, and I can't wait to share that with you. Until then, please give your pets some extra love for me. Bye, guys.